Have you ever heard of a woman giving birth without even knowing she was pregnant? Sounds mind-boggling, doesn't it? Well, welcome to the world of cryptic pregnancies, a medical phenomenon that's as mystifying as it sounds. Cryptic pregnancy refers to a unique condition where a woman remains unaware of her pregnancy until she goes into labor, or in some cases, even until she has given birth. Yes, you heard it right. Imagine the shock and surprise of not just the woman, but everyone around her when a baby arrives seemingly out of nowhere. Now you might be wondering, how common is this? While it's not everyday news, cryptic pregnancies are more frequent than we might think. Reports suggest that they occur in about 1 out of every 475 pregnancies. So, while it's not exactly a common occurrence, it's not as rare as a blue moon either. At this point, some of you might be thinking, surely these women must not be very in tune with their bodies. But let's dispel this misconception right away. Cryptic pregnancies can happen to anyone, irrespective of their health awareness or bodily knowledge. It's not about ignorance or denial. It's about the subtle and often misleading signs that these pregnancies present. Sometimes, the usual symptoms of pregnancy, like morning sickness, weight gain, or a stopping of the menstrual cycle, are absent or so mild that they're easily overlooked. Other times, medical tests including urine and blood tests and even ultrasounds may fail to detect the pregnancy, leading to this baffling situation. So cryptic pregnancy is not just a storyline for a dramatic TV show, but a real, albeit rare, occurrence. This just goes to show how incredibly complex and unpredictable the human body can be, reminding us that there's always something new to learn, especially when it comes to the mysteries of life. Stay tuned as we delve deeper into the science behind cryptic pregnancies in our next segment. Now that we know what cryptic pregnancy is, the question is, how does it happen? Cryptic pregnancy, also known as stealth pregnancy, is a phenomenon that baffles even the medical community. It's not a common occurrence, but it happens. At the heart of it all are hormonal imbalances, the silent puppeteers of our body's intricate systems. Our bodies are regulated by a complex cocktail of hormones, which control everything from our mood to our metabolism. In a typical pregnancy, the body produces a hormone called human chorionic gonadotropin, or HCG. This hormone signals the body that it's pregnant and triggers the well-known symptoms of pregnancy, like morning sickness and a missed period. However, in a cryptic pregnancy, the levels of HCG are unusually low. This can be due to a variety of reasons, including polycystic ovary syndrome, perimenopause, or even stress. The low HCG levels mean the body doesn't get the usual heads up that it's pregnant. Consequently, the typical symptoms of pregnancy may not manifest, and the woman might remain unaware of her condition. In addition to this, some women continue to experience bleeding during their pregnancy, which can be mistaken for a regular menstrual cycle. This bleeding isn't a true period. It's usually lighter and shorter than a regular period, but it can certainly add to the confusion. It's also worth noting that every woman's body is different. Some women naturally have fewer pregnancy symptoms, while others might attribute any changes to stress or illness rather than pregnancy. This combination of low HCG levels, continued bleeding, and individual variation in symptoms can create the perfect storm for a cryptic pregnancy to occur. It's a testament to the complexity and individuality of the human body, a reminder that it doesn't always adhere to textbook expectations. The human body is complex and fascinating, isn't it? But how can a woman recognize a cryptic pregnancy? Stay tuned to find out more in our next segment. Imagine not knowing you're pregnant until you're about to give birth. What signs might you miss? Cryptic pregnancy is a phenomenon that, while unusual, is more common than you might think. It's a condition where the signs and symptoms of pregnancy are so subtle that they can be easily overlooked or mistaken for other conditions. In many cases, the woman may not realize she's pregnant until she's well into the pregnancy or even about to give birth. One of the most common signs of a cryptic pregnancy is weight gain. However, weight gain can be attributed to many factors, such as changes in diet, lifestyle, or even stress. This is particularly true if the weight gain is gradual and consistent, as it often is in cryptic pregnancies. Abdominal pain is another indicator of a cryptic pregnancy. This pain can be very similar to menstrual cramps or digestive issues, making it easy to dismiss as a non-pregnancy-related ailment. Some women may even continue to experience what they believe to be their period throughout the pregnancy, further clouding the picture. Fatigue, another common symptom of pregnancy, is also easily overlooked. With our fast-paced lives and packed schedules, feeling tired is often chalked up to the demands of daily life rather than a potential sign of pregnancy. Nausea and vomiting, often referred to as morning sickness, can also be symptoms of a cryptic pregnancy. However, these symptoms can be attributed to a variety of other conditions, such as food poisoning or a stomach bug, making it easy for a woman to dismiss them as unrelated to pregnancy. In some cases, hormonal changes might not be as pronounced in a cryptic pregnancy. This can lead to negative pregnancy test results, further reinforcing the belief that pregnancy is not the cause of these symptoms. So cryptic pregnancy can easily fly under the radar, but what are the risks associated with it? Cryptic pregnancy might sound like an unexpected surprise, but it's not without its risks. Just like any other pregnancy, cryptic pregnancy comes with its own set of challenges that can affect both the mother and the baby. Firstly, let's talk about prenatal care. Regular prenatal visits are crucial for monitoring the health of both mother and baby during pregnancy. These visits can detect potential health problems early when they're easier to treat. They also provide the opportunity for doctors to educate mothers about steps they can take to ensure a healthy pregnancy. But in the case of a cryptic pregnancy, where the woman is unaware that she's pregnant, she may miss out on these crucial visits. This can potentially lead to complications during pregnancy and childbirth. Then there's the risk of unattended birth. In a cryptic pregnancy, the woman may not realize she's in labor until it's too late to reach a hospital. This can lead to a situation where she gives birth without any medical assistance, which can be dangerous for both mother and child. Psychological distress is another major concern. The sudden realization of being pregnant, especially at an advanced stage, can be quite a shock. This can lead to feelings of confusion, stress, and anxiety, not to mention the added stress of having to quickly adjust to the idea of becoming a parent. Let's not forget about the potential impact on the baby. The lack of prenatal care and potential for a stressful birth could have consequences for the child's health. It's not a scenario we should take lightly. In conclusion, while cryptic pregnancies may seem like an anomaly, they come with real risks and challenges. It's important for everyone, not just those directly affected, to be aware of these risks and to support women who may be experiencing these situations. Cryptic pregnancy is more than just an unexpected surprise. It's a medical condition that deserves our understanding and attention.